Bangalore last decade, and my parents live with me. And my mom is 75 years old, and on a routine checkup, we figured that she has a heart valve issue. We went about to multiple doctors in Bangalore, but I was slightly comfortable because I'm born and brought up in Bombay. I came here, I met a couple of doctors, and a doctor friend of mine, a very close client of mine, she recommended that I meet Dr. Nihar Mehta.
Well, I came across a very sweet and not so young lady called Mrs. Sarojani Rai, who was 75 years old, and she came with a health checkup showing a severe aortic stenosis. Aortic stenosis is basically where our aortic valve, which gives blood flow to the entire body, was completely choked up. Her valve had become so small that it was like a little pinpoint. This was causing tremendous stress on her heart, and because of this, the patient had a completely reduced life expectancy. Now, when she came to me, she told me, "Doctor, I don't have too many complaints. I lead a very simple life. I do my work in the house." I asked her, "Do you walk?" She says, "I don't like to walk because I get tired." I said, "Is the tiredness making you stop?" And she said, "Yes." So this is a very important point, that patients with this disease, they restrict their activities not because they are old, but because their heart doesn't allow them to. And with this in mind, we explained to her that if we replace your valve with a new valve, her life expectancy would increase and she would have a meaningful and uneventful life. Had she not agreed to replace the valve, this aortic stenosis would have led to chest pains, breathing difficulty, even fainting attacks, repeated fractures because of unexpected falls, and eventually death within 1 or 2 years. Now all this sounds so scary, but the patient said, "Doctor, I refuse to undergo surgery. I cannot have my chest opened." And we told her that at 75, surgery was not the first option for her. The first option was a procedure called TAVI, where we replace her aortic valve from the leg arteries without cuts, sutures and stitches, and under local anesthesia.
Someone introduced me to Dr. Nihar Mehta, saying that he is the expert in heart valve diseases, and that gave me more confidence talking to him because that's his forte. And that is when he told me about the procedure of TAVI as opposed to an open heart surgery, which I was very dreading considering the age of my mother. And then I did my research as well, and I figured that one, I'm in good hands because seems like Dr. Mehta has done this for many years now, and he is an expert in that domain. Two, it is a less intrusive procedure where my mom didn't have to go under the knife and be in the bed for 4-5 months. We got the procedure done on Monday. Today is Thursday, and I am about to take my mother back home. It's just about 4 days that we were here.
So we planned for her surgery. Within 4 or 5 days, she got admitted to the hospital. We did the procedure. Within 1 hour, she was out of the cath lab. All the time in the cath lab, she was chatting with me and talking to me while we were performing the procedure. An hour after the procedure, she was sitting up in the ICU and having a cup of tea. The day in the evening, she had a walk in the ICU, 2 days more in the hospital, and on the third morning, she was back in her home, comfortable, with a brand new valve, with the wonderful procedure called TAVI.
But I can vouch for the place, the Jaslok Hospital, where I took my mother, and Dr. Nihar Mehta. I can't thank him enough for treating my mom this brilliantly. So I would very sincerely recommend people to at least consider the process of TAVI, because I think it is the thing.
This case basically highlights how, especially in elderly people who are at high risks for surgeries and who have a prolonged painful surgery at times with several problems and complications, can undergo this relatively simple procedure called TAVI. And it is a procedure which opens the door to several of patients who do not undergo surgery simply because of being afraid. So I hope this puts their fears at bay and opens the doors to the procedure called TAVI for patients with aortic stenosis.